hear it all too often in my office where someone is told they have a tilted uterus, however, they aren't told how this might affect them. My name is Eric Schmidt, board certified OBGYN, minimally invasive gynecologic surgeon. We're talking about whether or not if you've told your uterus has been tilted to the front, to the back. You probably were told it during your pelvic exam or your pap smear, and maybe it wasn't explained all the way what it actually means. So, anatomy review. The uterus sits in the pelvis, bordered in the front by the bladder and in the back by the rectum. And the uterus often has a little forward tilt. Let me go this way. Forward tilt to it. And the bladder sits right here, and the rectum sits here. And so often there's a little forward tilt. 20 or so percent of the time, it has a backwards tilt. And so how can you tell, or how do you know if your uterus is tilted forward or backwards? Your provider often can tell on exam, or at least they can tell that it's tilted some way. Now, if we look at it from the same view, if the uterus, the top of the uterus, or the body of the uterus tilts one way, it has an equal and opposite reaction of the cervix, or the bottom part of the uterus, the other way. And so if we're doing an exam and a speculum exam and we're looking for the cervix, it's pointed actually down, meaning this part is pointed down. Someone likely has an anteverted or a forward-facing uterus. However, if it's more facing up, the cervix flexes this way, and when we look at it, it's actually the cervix a little more towards the ceiling when we're doing the exam. Not a huge point, but if a doctor maybe is doing the exam, it's taking a minute, and they're making this small talk of, oh, your cervix is tilted, and maybe that's a kind of a little bit of a filler for why it's taking a little bit of a minute to get the normal speculum inserted and find the cervix and get it to a point where they can perform the pap smear or whatever they're doing. It's just a filler of conversation, which is fine, but when it's left unexplained, that's kind of when it's maybe not so good. I certainly have a number of patients that come to see me, they've been told this, they're worried about it, they think it might be impacting them, when in reality, a tilted uterus overall is a normal finding. There's a couple other ways we can identify whether a uterus is tilted forward or back, and that's by imaging. This often is done with ultrasound, but you could also tell with CT or MRI. But in our profession, we're doing a lot of ultrasounds, and so you might notice this on the ultrasound reading, whether it's anteverted or retroverted. So why does this happen? Most of the time, there is no reason. It's congenital. It's just the way that the anatomy is faced, whether it's a gravity thing or not. It is something that is just, it's meant to be that way. There are some situations that can make it this way too. And probably most commonly is if someone's had C-sections. Sometimes that for a C-section, there's, we're going in this way and then making the cut to get the baby out. It causes the uterus to face more towards the abdominal wall, kind of artificially creating some anteversion. And the same for if somebody's had something like endometriosis or more advanced stage endometriosis, where the uterus might be flexed back, because most often those endometriosis lesions are posterior, behind the uterus, kind of on that rectal side, along the uterosacral ligaments, which are on the back. And so that can sometimes cause some scarring down back that way. So if a patient is coming to me and saying, I have this really bad cycles and periods and pain around that time, and their uterus on exam seems to be a little bit abnormally tilted, doesn't move as much, meaning it's likely there's some adhesions on the inside. This can also be with fibroids of the uterus, very common cause to the weight of a fibroid. If it's, again, equal and opposite, if it's in the front, it pushes the uterus back, and vice versa. So are there any major symptoms to watch out for a severely anteverted or retroverted uterus? Quick summary is no. This shouldn't really impact somebody on their daily life. Now, if they have that condition, whether it's endometriosis causing symptoms, and we notice the retroverted uterus, yes, that could be impacting things. Could all the scar tissue from the previous C-section scarring the uterus, could that have some adverse reaction and symptoms? Yes, but not necessarily just the simple physiologic tilt forward or back. That shouldn't cause any symptoms itself. It could be a possibility that if someone has a severely retroflexed uterus, retroverted uterus, and meaning it's closer potentially to things like the spine, the sacrum, the colon, could there be more symptoms if they already have dysmenorrhea? pain with dyspareunia, pain with sex, back pain during the periods, butt pain during the periods. Maybe this could be somewhat related, but I don't think we have any good evidence to support that. And a big question people have with their forward flexed uterus, with their backward flexed uterus, how does that affect the ability to conceive? And again, a normal physiologic forward tilt, backward tilt shouldn't affect it at all. And so don't let anybody tell you that. That itself should not be causing someone infertility. There is one situation that is super rare in pregnancy, and I think people hear about this, they see it, and they think this is going to happen, even though if it happens 1 in 10,000 times. I personally never seen it, but it's what's called an incarcerated uterus. If the uterus is tilted back, so far back that because the sacrum normally sits here, and it gets kind of stuck. It doesn't, because when a pregnancy grows the uterus, even if it's retroflexed, it'll start to grow normally and up into the higher pelvis abdominal cavity. But sometimes the sacropromontory has a little bit of a lip to it that sometimes can get a uterus stuck in an early pregnancy, and it can't grow up like it should. Again, I've never seen this. And this is 1 in 10,000 potential pregnancies. There is an important part to consider from a provider standpoint when it comes to anteverted or retroverted uterus. That flexion can make it more difficult to cannulate from through the cervix up into the upper part of the uterus. And so we have to do this for IUD insertions. We have to do this for endometrial biopsies, hysteroscopy, IVF. Infertility medicine often puts little catheters through. That's why it's good to identify, is that cervix seem to be flexed upwards or downwards, because that can give you a clue on how that IUD or how that other procedure is going to go in. A lot of those instruments have kind of this, are, designed for an anteverted uterus, because that's the most common. Again, 80% are anteverted, 20% retroverted. And so if you don't understand looking at the uterus, that might be a retroverted. I might have to flip that instrument upside down to follow that canal downwards. And so that's just from a provider standpoint. I encourage patients or providers to really kind of, get in tune with understanding just visually what a uterus is likely doing. Because that can have an impact on the pain during the procedure, the discomfort, and potentially, even if someone's really not paying attention to it, lead to those things like perforation, which we talked about, can be an issue 1 in 1,000 for IUD insertions or something like that. So let's summarize this. Should you be concerned if the doctor tells you you have a tilted uterus? No, you should not be concerned. It is quite common, and the majority of times people do have a tilt. It is a little less common to have a backwards tilt, but it still shouldn't have any significant implications. It could potentially clue you in if somebody has a scarring of the uterus, and it's kind of stuck in that position, to something like, they've had prior C-sections or they had endometriosis. But otherwise, this itself, a tilted uterus, is not harmful. It's physiologic. But when it comes to procedures, providers need to be aware of this, need to realize they might have to do something differently depending on which way the tilt is they suspect, or get an ultrasound to help them confirm, because we all want to make these procedures as good as possible because the patients deserve it. Quick plug, September, we're doing 30 videos in 30 days. I usually only do about 50 videos a year, so this is a big change. And we're doing it all for a good cause. We're trying to raise money for gynecologic cancers. September is Gynecologic Cancer Month. And so follow along. A subscribe goes a long way, because I need a certain number of subscribers to do the fundraiser on YouTube. So if you don't mind, subscribe, like the video. We'll see you soon.